first begin to say that we have been using electronic medical record here in this office since 2001. And I was approached in, I think, 2010 to use that software to the best of its ability to track or to generate statistics as to how many patients were getting CRC screening tests done. That included using the documentation as to whether they've had colonoscopies done and whether or not they've had stool hemoccult testing done. So through the use of the software, we were able to generate statistics, basically very much like the meaningful use we use now to figure out how many people over the age of 50 were getting their colorectal cancer screening test done. Quality Insights helped me with was the novel idea of using the computer to identify those people. Before, we probably would have had to do a manual chart review either on the computer or with physical chart. But through the computer, we also were able to identify people who hadn't been in the office for the past 5 years. So we actually picked up additional people who just don't come through the door. And that always is the hardest thing, finding the patients who do not frequent the doctor's office. How do you get them to follow up? And this method of using the computer does help identify those people. Every month we did notice that there were increasing numbers of people getting these tests done. I think the baseline we were at something like 40%, but towards the end of the 12-month period we were up to 52% getting their testing done. That year we decided to do the next step, which was to take those statistics and ask the question, well, who was not getting it done and why? So that summer I actually had 2 students working with me that had a project they wanted to work on, and we chose to do this. So we used some computer techniques to develop a mailing list as to who was not getting these tests done, and we sent a reminder with information that Quality Insights provided us for explaining what colorectal cancer screening was, what the tests were available for them to do, and we developed a mailing list. And we actually ended up with higher statistics of those people who responded. 60% ended up getting colorectal cancer screening testing done. So it was interesting. I believe that just by doing the phone follow-up and the mailing out the information, we actually increased the number of patients who followed through on their colorectal cancer screening. I just want to give you an idea of how many patients were identified. There were 200 that were identified by the computer as not having had any colorectal cancer screening done. And of those 200, 122 responded either by mail or by phone. And 50 of those already had CRC screening done. In other words, our electronic medical record wasn't updated enough. Well, that left about 73, exactly 73 who needed screening done, and of those, 8 elected not to have any screening done. And of the remaining 65 patients, they all went ahead and got either colonoscopy or hemoccult testing done, or both. In fact, 64 out of the 65 planned to get colonoscopy done. And it was one of those patients that ended up having early stages of colon cancer detected. The practice is about 4,000 active patients, and based on the incidence of colorectal cancer in this country, one would expect about 2 cases of colorectal cancer per year. And actually through this initiative, we did find, there was one patient who got the mailing, responded to the mailing, came in for a physical. We were able to arrange for colonoscopy. What this patient requested, and ultimately she was found to have early stages of colorectal cancer and is currently under treatment.